Well, today we're enjoying the 70s, but as the weather turns cold, more people start using generators, especially during a power outage. In addition to potential risk from fire and electrocution, carbon monoxide poisoning is a threat that people need to be reminded about. Here to talk about generator safety is Dr. Drew Ulrich, Corewell Health's Section Chief of Hyperbaric and Dive Medicine, Wound Care, and Limb Preservation. Doc, thanks so much for being here with us. First, what do people need to know about carbon monoxide poisoning, the invisible killer?
Yeah, right, exactly. I think the biggest things are, so carbon monoxide usually happens, poisoning usually happens from, in simple terms, just, using a gas-powered engine. So things like generators, hot water heaters, your heater for your house, bringing, like a gasoline-powered grill in, things like that. That's typically where we see it. It's an odorless, tasteless gas, so you're not going to be able to smell it if you're getting exposed to it. The best way to know is if you have a carbon monoxide detector. But it's very lethal, as you mentioned. It's very the most common poisoning in the nation, and it can be cause a lot of symptoms. Mostly, we see things like kind of like flu-like symptoms, headache, nausea, vomiting, but people can become unresponsive, and there's been many deaths from it as well.
Yeah. If you are going to run a generator, what do people need to know? Things to avoid?
Yeah, typically just well-ventilated area. I think people get into trouble when they're bringing generators in their house or near an open window. We see people that have are running their car in an enclosed garage. That can do it. So you just want to make sure there's plenty of ventilation to to dilute the carbon monoxide that's coming out from the engine.
Yeah. Tell us about the hyperbaric oxygen program at Corewell Health in West Michigan and what else it is used for.
Yeah, so we are actually the only center in West Michigan that does emergent hyperbaric treatments. So for things like carbon monoxide poisoning, it's a multi-person chamber. So basically multiple people can go in at once. That's kind of nice because some people get claustrophobic in the smaller chambers. This is more like a big room, if you will, like like an airplane. So up to 8 to 12 patients can go in at once. We treat all kinds of indications. It's typically a 2-hour treatment Monday through Friday, somewhere between a month to 2 months, depending on your indication for treatment.
What is unique about this chamber here?
Well, the biggest thing is that you could treat many patients at one time. Most centers just have like a single person tube, if you will. This is nice because you just have a lot more room to work. If we have an emergent critical patient, you have a lot more space to take care of that patient, and somebody can actually physically go in with the patient, like a nurse, to help out. So it's a little bit unique in that respect. We're the only center in West Michigan that is a multi-place center like that.
And it's used daily.
Yep. Yeah, we have 3 treatments a day for our routine patients. We do all different types of indications. The most common things are things like diabetic ulcers, like diabetic foot wounds that aren't healing. We see a lot of patients that have had radiation for cancer. Sometimes those patients can go on to develop problems from the radiation. And the hyperbaric actually really helps to obviously stimulate, high oxygen environment. So it stimulates new blood vessel growth. It helps to fight off infection, stimulates wound healing cells. So we use it for a lot of different indications that would be beneficial in that kind of scenario.
What does treatment look like?
So it's 2 hours long, like I mentioned. We typically have patients come in a half hour before their treatment. They change into hyperbaric kind of appropriate attire, get their vitals checked, go into the chamber. Then they usually are in there for about 2 hours. We have, we play a movie, you can read a book, take a nap, and then then you come out, and then just kind of repeat that Monday through Friday till till we get to that end goal of wound healing or whatever.
Anything else you want families to know right now?
I think the biggest thing in regards to carbon monoxide poisoning is it's really important to have carbon monoxide detectors in your house that are, obviously the ones that plug into the wall, but they have battery backup in case you lose power. Make sure they're by your bedroom so that when you're sleeping you can hear it. Again, because you won't be able to smell it, you won't be able to know that it's, that you're having a leak. So that's the most important thing.
All right, important reminder. Thank you so much for being here with us.
Yeah, thanks for having me.
Scott?